When we talked about the bones of the upper limb, we also discussed the attachments of muscular structure at those bones. In this section, we will jump into the details of muscle found in the pectoral region. Their names, origin, insertion, nerve supply, and action that muscle perform at specific joint. So let us dive in. Muscles of the pectoral region. First, let's look at the names of the muscle found in the pectoral region. There are 4 muscles that you need to memorize. Pectoralis major, pectoralis minor, subclavius and serratus anterior. It is easier to remember the names of these muscles once you see where they're present in the body. Let's look at them one by one. Starting with the most superficial muscle, that is pectoralis major. The pectoralis major muscle, as you can see, is a large muscle that has 3 distinct muscle bands. These individual bands originate from anterior surface of medial 2/3 of clavicle, anterior surface of the manubrium, and sternum 2nd to 6th costal cartilages. Aponeurosis of the external oblique muscle of the abdomen. An aponeurosis is a thin sheath of connective tissue that helps connect your muscles to your bones. Aponeuroses are similar to tendons. Based on the attachment site of the muscle fibers, they are also named as clavicular fibers, manubrial fibers, sternocostal fibers, and aponeurotic fibers. Its fibers converge and are inserted into the lateral lip of the bicipital groove of the humerus. That was the origin and insertion of the pectoralis major muscles. Now, to perform an action, the muscles must receive signals from the higher centers. For that, muscles of the body are innervated by the branches of different nerves. Let's look at the nerve innervation of the pectoralis major muscles, as well as the action that it performs. Before talking about the nerve supply of the muscles of pectoral region, let's briefly talk about the brachial plexus. At the root of the neck, the nerves that are about to enter the upper limb come together to form a complicated plexus called the brachial plexus. This plexus arises from the anterior rami of spinal nerves C5, C6, C7, C8, and T1 that undergoes several mergers and splits into trunks and divisions until they finally give rise to their terminal branches. We will talk about the brachial plexus in more detail in our video on the axillary region. For now, knowing that the branches of nerves that supply the muscles of upper limb originate from trunks of brachial plexus is enough. Coming back to our main topic. The nerves supplying the pectoralis major muscle are the medial and lateral pectoral nerves. These nerves branch off from the brachial plexus, which is a network of nerves situated in the shoulder region. So now that we have talked about the nerve supply of pectoralis major, let's look at the action of these muscular fibers. The function of the pectoralis major muscle is the adduction of the arm and medial rotation of the arm. You can easily remember the action of a muscle once you know where it is situated. For example, we have already mentioned that the pectoral region connects the upper limb to the anterolateral chest wall. So the muscle that originates from the chest wall inserts into the upper arm, draws the arm towards the body, that is adduction of the arm. That is all about the pectoralis major muscle. Now we will move on to the pectoralis minor muscles, which lies just below the pec major. The pectoralis minor muscle originates from the 3rd, 4th, and 5th rib as shown here. The fibers of this muscle converge and insert into the coracoid process of the scapula. Coracoid process of the scapula is one of the bony landmarks of the scapular bone. The coracoid process is directed forwards and slightly laterally. It is bent and finger-like. The nerve that supplies the pectoralis minor is the medial pectoral nerve, which is a branch of the brachial plexus as mentioned before. The main function of this muscle is that it pulls the shoulder downward and forward. If the shoulder is fixed, it can also elevate the ribs of origin that are the third, fourth, and fifth. That was all about the pectoralis minor muscles. You can pause and review the information we have learned so far. After the two pectoralis muscles, major and pectoralis minor, we have the third muscle of the pectoral region known as subclavius. The subclavius muscle is small muscle. As the name indicates, it originates from the first costal cartilage to be inserted at the inferior border of the clavicle bone. It is supplied by a branch of the brachial plexus. As it is attached at the clavicle, the action of this muscle is that it depresses the clavicle and stabilizes the bone during movements of the shoulder girdle. Strictly speaking, the serratus anterior muscle is not part of the pectoral region, but since it makes up the lateral border of the chest wall. The serratus anterior is a large muscle, as you can see here. The muscle originates from the outer surface of the upper 8 ribs. As you can see here, the muscle fibers then converge and move upward and laterally to insert at the medial border of the scapula. Some of the fibers of this muscle also attached at the inferior angle of the scapula. The nerve supplying this muscle is known as long thoracic nerve. As serratus anterior is a large muscle, it can perform a number of actions, including scapular or shoulder protraction. But you may be thinking, what is meant by scapular protraction? This is when the scapula moves laterally away from the spine. As you can see here, its counter movement is retraction of the scapula, which is when the scapula moves medially towards the spine. An example of when this movement occurs is that bench pressing. Stabilization of scapula during movements of the arm. Serratus anterior also acts as an accessory inspiratory muscle when the scapula is stabilized, such as when a person is lying down in a supine position. Another action of the serratus anterior muscle is the abduction of the shoulder above the 90-degree angle. That is all about the serratus anterior muscle. Now that we have talked about the muscles of the pectoral region along with their nerve supply, let's look at the vascular supply. Blood supply of the upper limb comes from a complex network of arteries and its branches. We will simply look at the arteries supplying the aforementioned muscles, so it is easier for you to remember the important anatomical of the pectoral region. The blood supply of these 4 muscles comes from 3 arteries. The thoracoacromial artery supplies both pectoralis major and minor. Its clavicular branch also supplies the subclavius. Subscapular artery is responsible for the cutaneous supply of the blood, meaning that it supplies blood to the skin of pectoral region. It also supplies the subclavius muscles. Lateral thoracic artery supplies the serratus anterior muscle. That is all about the pectoral region. Let's quickly go over what we have learned so far. So we started our lecture by talking about the surface anatomical landmarks of the pectoral region. We can see the clavicle, jugular notch, sternal angle, nipple, and epigastric fossa on the anterior aspect of the chest, as well as the coracoid and acromion processes of the scapula can be felt at their specific location. Then we moved on and discussed the location, features, and lymphatic drainage of the breast before moving on to the muscles of the pectoral region. There are 4 muscles of the pectoral region that we discussed in detail along with their origin, insertion, nerve supply, and action. We will be covering the axillary region and its contents in an upcoming video. So stay tuned to sqadia.com to learn anatomy in an easier manner.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.